Palpitations are an awareness, usually an uncomfortable awareness of your heartbeat. They can be regular, irregular, fast, slow, can last for a few seconds to a few minutes, hours, or even days. There are many causes. Thankfully, the majority are not due to any serious heart issue that, for instance, is going to affect your life expectancy, but of course they can be very concerning and cause anxiety. And actually anxiety is a common cause for palpitations. Often cause for palpitations is extra beats. We call them ectopics. But then there are a number of patients who have palpitations due to a genuine heart rhythm problem. Atrial fibrillation is a diagnosis of actually the commonest heart rhythm, sustained heart rhythm problem, and it's extremely common. 1 in 4 people beyond the age of 40 will develop atrial fibrillation at some stage in their life, and it is a very significant health problem because it confers a significantly increased risk of having a stroke. In fact, it's the leading independent risk factor for stroke and will increase your risk by approximately 500%. Thankfully, there are very good treatments for atrial fibrillation. I divide the treatments or the management of atrial fibrillation into 2 components. The most important component is to address that significantly increased risk of stroke. And we have wonderful treatments known as anticoagulants that will significantly reduce that risk by over 2/3. And there are many anticoagulants now available. Historically, up until recently, warfarin was the only treatment available, but we now have newer treatments that are more convenient to take and require less monitoring and actually have been proven in many respects to be safer than warfarin. So the other important component of the treatment of atrial fibrillation is to control the heart rate and sometimes even control the rhythm. Most patients with atrial fibrillation will tend to have a fast heart rate, and simply lowering that heart rate, which can usually be easily done through medications like beta blockers, calcium channel blockers. Occasionally we have to add in a drug called digoxin, and slowing that heart rate can really improve the symptoms in many patients with atrial fibrillation, because some of these patients are quite breathless, limited by their atrial fibrillation in terms of some of their activities and hobbies, gardening, walking up an incline, a flight of stairs, but slowing that heart rate really helps improve those symptoms. But sadly, there are a group of patients who remain significantly limited in terms of symptoms despite rate control. We also have a group of patients whose hearts don't actually cope very well by being in that irregular rhythm of atrial fibrillation, and also patients who tend to have intermittent episodes of atrial fibrillation known as paroxysmal atrial fibrillation. For those groups of patients, we have a low threshold for considering a rhythm control strategy where we're aiming to sort of restore a normal, regular rhythm known as sinus rhythm. And we can do that through medication with drugs known as antiarrhythmic drugs, but increasingly now we are learning the value of considering cardiac intervention known as catheter ablation. And this is an intervention that can really help improve the symptoms and quality of life of these patients. It can't cure the atrial fibrillation, but there is also emerging evidence actually that catheter ablation may even improve outcomes. So in Bupa, we're very, very keen to have processes in place to ensure that our patients with atrial fibrillation can get appropriately considered for procedures like catheter ablation. So heart murmur is simply a sound coming from the heart due to the blood flow within the heart, heard by a stethoscope. A very common finding, usually an incidental finding made by, for instance, a doctor during a health assessment. The majority, thankfully and reassuringly, are not due to any significant underlying problem with the heart, but occasionally heart murmurs can be due to a problem with the structure of the heart, and in particular a damage to one or more of the heart valves, which is why all patients with a murmur really should be checked out. Heart valve disease can be dangerous, particularly if it's causing a patient's symptoms like breathlessness, lightheadedness, or the feeling of perhaps passing out, wanting to pass out. because that indicates that the valve disease has probably become quite severe and putting significant strain on the heart. And really, these patients should be referred for an urgent specialist assessment. And the gold standard first-line test for that is usually an echocardiogram, which uses the same technology as a baby scan. So it's an ultrasound scan, but looking at the structure and the function of the heart.